So good afternoon. It is another Friday and another opportunity for us to provide you with an update from North of Superior Healthcare Group. I'm Sarah Newberry. I'm one of the family physicians here and Chief of Staff, and I'm here with Adam Brown, our hospital CEO. We thought we would talk about three things today. We'll start by giving you a bit of an update about what's happening at NOSH and within the community from the standpoint of COVID-19. We'll talk a little bit about communication with the hospitals and an invitation to how we might do that going forward. And then we'll talk about how we see the next few weeks evolving. So to begin with a bit of an update, we have no documented cases of COVID-19 in our community, and we've had no documented cases of COVID-19 within our hospital. And as we've said over the last few weeks, the fact that we have no cases is really due to you and the good work that you're doing to self-isolate when you have symptoms or when you're returning from travel abroad, and to maintain social distances when you are out in public at the grocery store, the post office, and for all of the work that you're doing, which we know is difficult, we want to extend to you our thanks. We want also to let you know that we are continuing active screening at the door of the hospital. So even though we have no documented COVID-19 in the community, every person who comes to the hospital, whether that's a staff member or a member of the public, will be asked the same set of questions about symptoms, contact with someone who may be COVID positive, or whether you yourself have had COVID-19 testing. And that helps us to know how best to help you move through the hospital for the services that you need. Everyone who comes to the hospital will be asked to wear a mask, and you will also notice that everyone who works here in the hospital will also be wearing a mask when we are moving through the hospital building. We are still absolutely a fully functioning hospital. So if you need to come into the Emerge department, we will ask you to call ahead before you come. But we do want to make sure that you are coming to the Emerge department if you have symptoms that you are worried about. We also want you to know that the X-ray department and the lab department, ultrasound, are all open services. And so here in Marathon, if you need lab work, X-ray or ultrasound, you are invited to come during the hours that those services are open and receive those services. In Terrace Bay, those services are by appointment only, and so we invite you to call the reception at the hospital there to be able to begin to book an appointment for those services. But really what we want to ensure is that people are getting the service that they need. We are a fully functioning hospital still. And with that, I'll turn it over to Adam.
Great, thanks, Sarah. As Sarah's mentioned, that we've had another really successful week, and I want to reaffirm Sarah's statement that we really want to express our thanks to all of you in our communities for following the guidance and being really respectful and committed partners to us at the hospitals in Terrace Bay and Marathon. And we are going to win this. We're getting to the point where we can smile a little bit and maybe have a day off. And at some point in the near future, we will be able to relax rules, and Sarah will talk about that in a few moments. What I do know, however, is that anxieties continue to exist and fear continues to exist. And we are seeing some of that in our communities in areas such as social media posts. For the most part, our social media posts on areas like in Facebook are very positive, very respectful, and supportive of everyone in our communities who is working really hard, including all of our municipal leaders and of course healthcare workers and support service staff and on and on and on. But there are a few cases where social media hasn't been used to its best intent, and negative posts and challenges to those people that are providing good services have been expressed through social media. What I want to encourage and appeal to you today is if you do have a concern with the services that are being offered in our hospitals or in our clinics or anywhere else, I think social media is probably not the best, most effective, most efficient way to get your concerns, your criticisms, or your suggestions across. For the hospitals, for North Superior Healthcare Group, I am very open and actually encourage you, if you do have any of those concerns, suggestions, or criticisms, to contact me directly. I pick up my phone all the time. As Nicole at home will attest, I'm always on it. My phone number is 228-0304. Please call me if you have a concern. If you're not comfortable calling me, you want to remain anonymous, you can talk to my email line. My email is abrown@nosh.ca. NOSH is spelled N-O-S-H, so abrown@nosh.ca. If you want to remain even more anonymous, we do have a feedback button on our website. Our website is www.nosh.ca. healthcare.nosh.ca. You will get a response through that channel, and your concerns are legitimate. You wouldn't be wound up, you wouldn't be anxious, you would not have fear, you would not have anger if your concerns weren't legitimate. We treat them very seriously, and we want to address them to you personally. So please call or address any of those concerns through the media channels that I had mentioned. Again, my phone number is 228-0304.
So, and just to build on what Adam has said, part of the phase that we're moving into now as a hospital facility is to begin to think about how we can soften some of the restrictions that we felt were really important to implement at the start of the COVID-19 pandemic. So, as people likely know, we have fairly stringent visitor restrictions, and that has been an important part of the way that we have protected our patients who live in chronic care and at Wilkes Terrace in Terrace Bay and at Peninsula Manor as well. The decisions around visitor limitations have been really important. As we move forward though, we do want to hear your feedback and be able to have a conversation about how we begin to implement changes that can maintain our goals of protecting patients in the building, but also ensure that people are able to connect with their loved ones. We are going to move into that slowly and carefully because our primary goal is to protect the patients that we are all here to serve and that we as a community care about. And we know that we will make some missteps along the way, and we want to hear your feedback about those steps as we begin to make them and as we begin to change and move into the next phase of this pandemic. Having recognized that we need to begin to think about how we move into the next phase, I do want to say that we're not there yet, and that the importance of self-isolation when you have symptoms, the importance of maintaining that 2 meters of physical distancing when you're out in public, those really remain key to how we manage to prevent the transmission of COVID-19 within the community. The other really important piece of that is hand washing and hand sanitizing if you don't have access to a sink and soap. And I want to thank all of the business people in the community who have made hand washing stations available. I think those are going to be a fixture of community life for the next long while, likely. And so we're grateful for the efforts of community members to support that additional piece of how we prevent the transmission of COVID-19 in the communities. We need to stay the course with all of those things, even as we begin to think about how we might soften and lighten some of the restrictions that we have implemented as a hospital and care community. I also want to say that we understand, and we've talked in the past about the importance of the value of cloth masks in terms of preventing transmission of COVID-19. They are more important for prevention of transmission from me, the wearer of the mask. But I think as we move forward, using cloth masks as we move in the community may be an important part of how we continue to prevent the transmission of COVID-19. And certainly it is going to continue to be an expectation that when patients come to the hospital, when they come to our clinic settings, particularly if you have symptoms, that you will put on a mask when you come. And if you already have a cloth mask at home, we want to encourage you to wear that when you come to our facilities and to continue to take good care of the cloth masks that you have. We've had a large number of volunteers work very hard to make sure that community members and healthcare providers can access cloth masks. We will not be out of the woods of this pandemic for many, many months. And so we really want you to treat those cloth masks like the treasure that they truly are. They have been an investment of people's time and energy, and we want to be sure that people use those and care for them wisely because we will continue to need them. You as citizens will continue to benefit from them for many months down the line. So I want to say thank you at this point. Adam has said thank you to municipal leadership for all of their work to protect communities, and I want to say thank you on behalf of the hospital community to all of the volunteers who have stepped up in so many ways to support the protection not only of healthcare providers, but in fact, all of you as well. So thank you to all those of you who've made those significant contributions to our healthcare community and our life as a community together. I think with that, we will close for today, and we'll look forward to bringing you an update next Friday.